First, it was masking and COVID shots. 6 years later, politics and science are clashing yet again. And once again, it affects our kids. Last week, President Trump signed an executive order in an effort to limit the number of routine immunizations children are given and space them out in some cases. He wants the federal government to only recommend 12 vaccines for illnesses like chickenpox, HPV and polio. RSV and hepatitis vaccines would only be recommended for high-risk groups, and getting flu and COVID shots would be up to doctors and parents to decide. And he called for the MMR vaccine, which has been around for 55 years, to be split up into 3 vaccines given at 3 separate times. The president claimed without evidence that the MMR shot could be quite lethal, in his words, but couldn't give a clear answer on why when pressed by reporters.
Is there any evidence of that?
No, what I've heard is that there are some people that say it is that way.
He also made false claims about autism. Right now, measles, mumps, and rubella vaccines aren't on the market in the U.S. as separate shots. Earlier this year, court struck down another effort to change the vaccine schedule, so you can expect more legal battles here. President's even getting some pushback on this from within his own party, with Louisiana Republican Senator Dr. Bill Cassidy stressing that vaccines are safe and effective and don't cause autism, writing, "Breaking up vaccines will mean children have to get more shots to get the same protection, not fewer shots. It will increase hesitancy and make children less safe." Health experts went a step further.
Children are going to end up contracting diseases they could otherwise avoid. Some percent of those are going to end up in an ICU, and some percent of those are going to die.
Despite this new policy directive, states have the final say on required vaccines for children, though the president also pledged for the U.S. Department of Justice to act if certain rules aren't followed. So at worst, there's misinformation out there right now. At best, new confusion for parents as they get their kids ready for the new school year. Let's get to the heart of the matter with Dr. Marvia Jones, Kansas City, Missouri's health director. Thanks so much for coming back. First off, a bit of a bombshell in the public health world, I imagine. What's your professional take on these proposed changes?
Yeah, my professional take, Cody, is that this type of change would be disastrous for families if they are confused in any way about what they should seek for their children. So it could be really harmful if people get kind of lost in the weeds on this.
Well, we've talked about vaccine hesitancy before, and that was really at a fever pitch 6 years ago, but there are still some lingering effects there. What does this kind of mixed messaging do for that, and how do you try to cut through that with parents and families?
Yeah, Cody, as someone who's had young children before, I've been a mom of really young kids, you really have this overload of information, and it can be confusing to have to make decisions through that. So my heart goes out to families. We're just trying to do the right thing.
Is it just recommending that they talk to their physicians? I mean, part of this was the president says about a personal choice between a family and the doctor.
Yeah.
Is that still the route to go? And there's still medical experts.
Yeah, there are still medical experts, and we remind people to continue to talk to their healthcare providers. But at the same time, there are some things that are just kind of accepted as safe. Vaccines are safe. As you said, they've been around for 55 years. We have good data on their safety and their effectiveness. So some of these things we don't necessarily want a long conversation and wondering and new research having to be done every time someone goes to the doctor.
So what does the Kansas City Health Department do?
The Kansas City Health Department is really focusing on expanding access, making sure that we have increased our hours, because we still believe the average person in Kansas City and in our state wants to have their child vaccinated in preparation for school. So we're trying to make that easy, trying to make it fun for folks to bring their kids in, get out, get back on with their lives.
Well, you mentioned, I mean, right now, this is a major time of year to get kids back in the swing of things with vaccination clinics. How do you navigate that, and have you heard from anybody since this announcement?
We see families that are continuing to want to make sure, is this still available for me? Hey, I heard the president say this. Am I still going to be able to get my kids vaccinated? And that's been really good for us to hear that people are still seeking this out.
You know, for many families, one doctor's appointment is enough, right? Try to schedule, bring your whole family and do that. When we talk about the MMR vaccine being spaced out, I imagine 3 or more, there could be missed appointments potentially.
Absolutely.
So what do you advise right now? Because we should note, no changes have happened yet. This is still probably going to go through the legal process.
Absolutely. Recommend people to continue to get everything on schedule as it is already prescribed. Doctors should not be changing any schedules at this time. Nothing has changed. Continue to get them on schedule. They will still be covered under all insurance at this time. So really nothing changes for families.
The MMR shot, as we said, has kind of gotten the lion's share of the headlines because of the drastic changes that are being proposed. Again, it's been grouped together for 55 years. Tell us about measles cases, because those have cropped up in our area and around the country, and how effective is the MMR vaccine?
Yeah, what we have seen is in this past year or so, we've seen more measles cases around the country than we've seen ever in recent history. And so we know that some of these changes, some of the misinformation is taking effect in some people. And we do see a preponderance of the cases of measles in people who have no vaccination history. The vaccinations, especially MMR, is really important for folks. This is not just a rash we're talking about. There is a subset of folks who are going to suffer from severe complications as a result of measles.
So again, stay the course for now. We'll keep you apprised of any changes. Dr. Marvy Jones, Kansas City Health Department, thank you so much. Count on KMBC 9 News as we cut through the clutter and mixed messages to help keep you and your family safe. Watch our reporting on air and online at KMBC.com.